Hi, my name is Jean-Pierre Mena, and I'm a pharmacy intern. How can I help you today?
Hi, my name is Solange, and I just had a couple of questions that I wanted to talk to you about.
Sure. Tell me, how can I help you?
So, I party a lot, and I have a lot of friends, and I always end up in compromising or
Si-
having sex with people
Situations, yeah.
situations, and I'm really scared about HIV.
Oh, okay.
I've heard a lot about it, and I'm just trying to be safe and have protect myself apart from using a condom. It doesn't, not all the time. I feel like it doesn't apart like go above using a condom, and I don't use it sometimes, so I just want to be protected and safe. Is there are there options for me?
Sure. Uh, there's this medication called PrEP.
Mhm.
Uh, it's a medication that uh, helps you make sure that you don't get infected with HIV.
Mhm.
Uh, PrEP is a medication that you're gonna have to take for several days in order for this to have a full effect on you.
Mhm.
But before taking this medication, you're gonna have to see your primary care and make sure you get tested for HIV,
Okay.
so we can make sure that you don't have HIV already. This medication you have to take it if you don't have HIV. Uh, you're gonna have to check with your healthcare provider every 3 months. I'm pretty sure they're gonna walk you through all these steps.
Okay.
You can always use a telemedicine, which is just through video calls, make a follow up through video calls, and just call your doctor, make sure that you're doing the right thing. Uh, there are two types of PrEP, and I feel like the one that you are fit for is called Truvada. Truvada is a type of PrEP for people who are at risk of getting HIV-1,
Mhm.
especially for females.
Okay.
Like I said, you must be HIV negative before we start using this.
Okay.
It doesn't prevent any other sexually transmitted infections, STIs, or pregnancy. Okay, this only works for HIV specifically. Like I said, we're gonna have to talk to your healthcare provider,
Mhm.
and you're gonna have to take an HIV test to make sure you don't have HIV already.
Okay.
Uh, make sure that you don't use like any type of needles, like you don't share any type of needles. That's the main. And that's another reason why people contract HIV.
Mhm.
You gotta be really careful. Truvada by itself is not a complete treatment for HIV. One, you don't have to take it, or you cannot take it unless you are confirmed to be HIV-1 negative.
Okay.
Okay, that's why we have to take the HIV test first. Uh, Everything good so far? Like you understand how the PrEP works? That you have to take it um, before actually contracting HIV, and you have to take an HIV test. Kind of got all that information.
Yeah, I understand that before I can start PrEP, I have to actually get a test and be HIV negative. And this is a prescription that would come from my doctor's office. If I would want to start something like that, I have to go to the doctor to get a prescription for it. And just to practice safe sexual habits, like not using needles, exchanging needles, and try to practice safe sexual practices in order not to contract HIV.
Exactly. And so, in order for this to have full effect, if you're having anal intercourse,
Mm-hmm.
you're gonna have to take it for 7 days. before it actually reaches the full potential of the medication.
Okay.
In case you're having vaginal sex, sex through the vagina, you will have to take it for 21 days in order for this to have full effect. Okay. Remember, the PrEP is a medication that you use before you have the intercourse, not after. Like it's gonna prevent you, but it won't cure the disease after you contract it. Okay.
Yeah.
And like I was saying, Truvada, it's really good. It actually fits your standards. Remember that you don't have to miss. You can miss any dose of the Truvada. You have to take it on a regular basis. If you ever miss a dose, or if you don't want to take it anymore, just make sure you contact your healthcare provider. Make sure you let them know. Make sure that you get tested for other sexually transmission diseases. Also, talk to your provider about any type of ways that can help you reduce HIV contraction or HIV infection. Do you have hepatitis?
The last time I got a hepatitis B test was back a year ago, and it came back negative.
Came back negative.
I don't think.
Okay, that's really good. But just to make sure, just to be on the positive side, make sure you get another test for hepatitis B. Truvada has serious side effects, especially with hepatitis B infections. If you start, if you have hepatitis B and you stop taking it, you might get really serious side effects, and we don't want that.
Okay.
Like I said, you cannot take it if you already have HIV-1, okay? Just make sure that you get tested. You might probably see some kidney problems. This is pretty common. That's why you gotta do a follow-up with your primary care provider all the time to make sure that you are on the good side, on the safe side. Like I said, talk to your healthcare provider. That's the key for this treatment to actually work the best. Make sure you get HIV tested. If you have some side effects, stop taking the medication and immediately contact your healthcare provider so you guys can discuss what's the best, what's the next step, or what's best for you.
Okay.
Do you understand like what I said lately? Can you walk me through to what I said, please?
Yeah, I understand. You talked about the different kind of sex, if it's anal sex or vagina sex. The dosing is different. So for anal sex, I would have to take it for 21 days, and for
anal sex, actually 7 days.
And for vagina sex, I would have to use it for 21 days.
21 days, exactly.
And I might experience some kidney problems with it. So just make sure I follow up with my prescriber to make sure everything is going well.
Exactly. And remember that Truvada is the best fit for you. I'm pretty sure whenever you talk to your healthcare provider, he's gonna tell you the same thing. He's gonna walk you through the 2 types of PrEP. Based on that, he's gonna tell you which one is better. I feel like Truvada is the best. And I hope you found everything you were looking for, and I hope that I cleared all your doubts.
Yeah, I think pretty much that's what I was looking for today.
All right. Well, that was my pleasure. Is there anything else that I can help you with?
No, thank you.
No problem. You have a nice day.
You too.
Bye.
Bye.